Good morning, students. Next exam of ours mostly will be the sensory organs. All pharmacy and GNM and BSc all having most of the time 10 to 20 numbers of MCQs are coming, either in a form of a fill up the blanks or match the following. Here we will see the one glance of the like either MCQs or the fill up the blanks of the sensory organs. The first one question is a visual center of retina. Where is the visual center of retina? Optic disc, optic nerve, or ora serrata or macula lutea. So the answer will be the macula lutea. In the retina of the eye, all the neuronal fibers are passing through where? Optic disc, or macula, or optic chiasma, ora serrata. So the answer will be a optic disc. Optic disc is where the place all the fibers are crossing. Third one is the margins of the blind spot is called macula, optic disc, ora serrata, optic chiasma. Of course, it will be the optic disc. The fourth question, the point where the optic nerves of the both eyes are meeting, that is optic tract or optic chiasma, optic nerve or ganglionic fiber. Where they are meeting and crossing each other is mainly optic chiasma. The fifth question is the eyeball where is the high concentration of the photoreceptors are present. You know, optic disc, fovea present in the macula or neuronal layer or in chiasma. The answer is B, fovea present in the macula. In sixth, in eyes, which is responsible for to convert the electromagnetical waves to the electrochemical waves? A. Retina, B. Rods and cones of retina, C. Pigmented layers of retina, D is macula. Answer is B. Rods and cones of retina. Seventh is how many layers present in the retina? 5, 10, 2, 3. Everybody will be knowing the answer. It is a 10 layers. Name the cells which holds the rods and cones in its place. So, which is the cell which is holding the rods and cones in the place? Not only rods and cones and all the cells it is playing in its place, because otherwise it will cause a short circuit. First one is amicron cells, horizontal cells, ganglionic cells or Muller cells. The answer is the Muller cells. Ninth question is retina is the dash, outermost layer, innermost layer, middle layer or uveal tract layer. Of course, it is a innermost layer. Otherwise, it is called the neuronal layer. Outermost layer is the sclera and cornea. Correct? Otherwise, it is called the protective layer. Which is the following responsible for constriction of the pupil? A. Pigmented epithelium of iris. B. Ciliary body. C. Retina of the eye. D. Pigmented layer of the eye. The answer is pigmented epithelium of iris. 11th question. Name the nerve supply of the ciliary body. A. Optic nerve. B. Third cranial nerve. Nasociliary nerve of trigeminal. D. Facial nerve. The answer is nasociliary nerve of trigeminal. 12. The elastic circular biconvex body is present in the eye is called. Everybody will be knowing the answer. It is not a ciliary muscle or B. Iris. It is a lens. C is the answer. In eye, the layer is having a rich supply of the blood. Which layer is having the rich blood supply? A. Neuronal layer. B. Sclera. C. Choroid. D is macula. Of course, the answer is a C. C is a choroid. What is the other name of the uveal tract? Yes, of course, other name of the uveal tract is also a answer C. It is a choroid, not optic disc or macula. Yes. 15. The protective layer of eye is A. Sclera and cornea. B. Choroid. C is retina. D is iris. What is the protective layer? Sclera and the cornea. In that, one is opaque and the other one, cornea, is a transparent layer. If you see, it is cornea is 1/6, sclera is 5/6. Most of the part, it is the anterior side is cornea, posterior side is called the sclera. The eyeball, in the eyeball, the midway between the corneoscleral junction and the equator of the eyeball is having A. Macula, B. Ora serrata, C. Optic chiasma, D. Optic disc. Of course, it's a finger-like projection which is called ora serrata, which is the one, it is just below the corneoscleral junction. It looks like a finger-like projection which is present. That is the correct answer. Next, 17th question. Does the pigmented layer of retina have rods and cones? Do they have? No. Of course, the answer is no. 18th question. The light receptors of the eye are A. rods and cones, B. ganglionic layer, C. choroid, D is a pigmented layer. The light receptors? Very well. Yes, good. That is rods and cones is the correct answer. 19th. In eye, light passes through A. cornea, aqueous humor, lens, vitreous humor, optic disc, then action potential, then cranial nerve. Lens, ciliary body, ora serrata, optic disc, and central nervous system. Lens, macula, optic chiasma, cranial nerve. Sclera, cornea, lens, macula, corneal nerve. So very well. This is the first A is the correct answer because light passed through the transparent layer cornea, reaches the aqueous humor, then it passing through the biconvex body, that is called lens, and passing through the vitreous humor, reaching the optic disc, action potential, cranial nerve. Yes, this is the A is the right answer. 20th. In eye, which is called the part of central nervous system. Which is called the part of central nervous system. A. retina, B. choroid, C. optic disc, D. optic chiasma. What is that? Retina is the part of central nervous system. 21. In embryonic life, the retina develops from A. telencephalon of the forebrain, diencephalon of the forebrain, mesencephalon of midbrain, medulla oblongata. Of course, answer is B. diencephalon of forebrain. Okay, next question. What is called light sensitive part of the retina? Can you guess what is the light sensitive part of the retina? Yes, that is the equator of the eye. Yes, one is the A. ora serrata, macula, or C. rods, or D. optic disc. But answer is ora serrata. It is the light sensitive part of the retina. 23. Question is, where is the retinal artery originated from? A. aorta, optic chiasma, ophthalmic artery, D is a renal artery. Yes, it is, answer is C, it is ophthalmic artery. In eye, the sharpest vision or the center of vision is called A. macula, lutea or fovea, B. ora serrata, optic chiasma, D. rods and cones. Yes, answer is macula, lutea or fovea. The visual pigment is A. rhodopsin, B. melanosome, C. ganglionic cells, D. Muller cells. Of course, the answer is D. rhodopsin. This rhodopsin is where is present? Present in the rods. Then what is melanosome? Melanosome is present in the pigmented layer of retina, which is melanosome is present. Muller cells, of course, no. Ganglionic cells, no. And Muller cells is the cell which is holding all the layers is in position, especially rods and cones, and also otherwise it will cause the short circuit. Yes, the 26th, bipolar cells generates. What it is generates? What is the bipolar cells are generating? A. Graded potential. B. Action potential. C. Nothing. D. Electrical impulses. Yes, answer is a graded potential. 27. RBG cells takes information from. Where it is taking information? RBG cells. A. Inside to outside. B. Outside to inside. C. Horizontal or reverse. Isn't it? So answer is not A, not answer. A is not answer. So B is the answer. It is always outside to inside. Horizontal cells are high cells, not this one. Reverse cells are different. So answer is outside to inside. So rods and cones are present in the outer layer next to the pigmented layer. So pigmented layer and rods and cones, it is present towards the outside, not the inside. Inside all the ganglionic cells and other cells are present. 28. Horizontal and amigron cells takes the information from. Where are they taking? Is it from laterally, B vertically, C inner or outer? It is, yes, the correct answer is A. They are taking the information laterally. In retina, information taken outer to inner in reverse direction is by. Which is the cells are taking in a reverse direction? A. Amicron cells. B. Horizontal cells. C. Inner plexiform cells. D. Outer plexiform cells. Yes, answer is a interplexiform cells. So we in the picture we might have seen we are connecting both and we are marking as I, the interplexiform cells. So the answer is a interplexiform cells. Yes. Next, which is the cells in the retina act as a dendrites? So A. Muller cells, B. Bipolar cells, C. Ganglionic cells, D. Plexiform cells. So the answer is B. It is a bipolar cells. That is a special cells which is really present in the retina, brain, olfaction and ear. These are all the places mainly you can find these cells. Which cells in retina act as an axon? So, which cells in the retina act as an axon? So, A is a ganglionic cells, B bipolar cells, C glial cells, D plexiform cells. The answer is A. It is glial cells. Question number 32. The direction and the flow of signals of retina is, it's already repeated question. You will be knowing inner retina to outer retina or outer retina to inner retina or middle choroid part or none of the above. The answer is so clear. It is B, outer retina to the inner retina. Yes, the next question is so simple. The approximate number of rods present in the retina is A. 50 million, B. 100 million, C. 5,000, D. 10,000. Yes, answer is B. 100 million. The approximate number of cones which are present in our retina is 5 to 7 million. Cones are less in number. The network of cells forms which layer of the retina? It's very simple. Answer is A. Plexiform layer, B. Bipolar, C. Ganglionic nerve fiber layer. Yes, of course it is plexiform layer is the one forming the network like a structure. That is the one which is forming one layer of retina of the eye, that is especially forming the plexiform layer. When the retina develops in the embryonic life, 6th week, 4th week, 10th week or 16th week? Yes, answer is 4th week. In color of the macula is orange, B black, blue, D is yellow. So the color of the macula is yellow. So the answer is D. Okay. Then 38, aqueous humor is secreted by dash. It is ciliary gland. So the epithelium of ciliary gland which is secreting the aqueous humor. Intraocular pressure is between 10 to 20 milligram mercury. Increased pressure in the eye causing what? Increased pressure in the eye, it is causing the cataract. The tears are secreted by lacrimal gland. The photoreceptors are dash and dash, rods and cones. Cones are responsible for color vision. Inflammation of the conjunctiva is called conjunctivitis. Strabismus is called cross eye, or the otherwise it is called the squint. Chronic vitamin A deficiency leads to keratomalacia. The keratomalacia, in the beginning they will have a symptoms called night blindness. During the night time they could not able to see. That is the symptoms. If you are not correcting with vitamin A, it will be leads to complete keratomalacia. The night blindness will lead to complete blindness. Nearsightedness is called what? Dash. It is called myopia. Rods are the receptors of dim light. Opaque area of the lens is called cataract. Long-standing diabetes mellitus called diabetic retinopathy. Chronic vitamin A and protein deficiency in a diet cause keratomalacia or night blindness. Dash sensory organs involved in balance ear. Cerumen is secreted by ceruminous gland. Dash collects and transmits the information to auditory meatus. It is pinna. The length of the auditory meatus is 2.5 centimeter. The structural and functional unit of hearing is called cochlea. The smallest bone in the ear is called stapes. The membrane separates the auditory meatus from the middle ear is called the tympanic membrane. The hearing area is present in the dash lobe, temporal lobe. Two windows in the ear or the oval window, round window. The fluid filled in the bony labyrinth is called perilimb. The shape of the pinna is S-shaped. Otitis media is commonly seen among children. Hammer-shaped bone is in the ear is called malleus. The anvil-shaped bone in the ear is called incus. The sternum-shaped bone in the ear is called stapes. The oval window is covered by stapes. The roof and the floor of the middle ear is formed by temporal lobe. The receptors of the hearing is located in the, where is the receptors of the ear is located? In the corti. Okay. The auditory pathway ends in which lobe of cerebrum? It is in the temporal lobe of the cerebrum. There are three ossicles, right? Three ossicles in the ear is three ossicles, otherwise is called bones. Malleus, incus and stapes. The smallest bone is called the stapes. The part of the tongue that contains the taste buds, that is sense of bitter, it is posterior, 1/3 of the posterior part of the tongue. The largest papillae in the tongue It is called the circumvallate papillae. There are few in number, maybe within 12 to 14 or 10 to 12 only in the number. Das papillae located in the tip of the tongues. That is called filiform papillae. Das papillae does not having containing the taste buds. Yes, that is again his answer is filiform papillae. The sense of the taste is closely related with the sense of smell. The largest organ in our body is skin, right? The subcutaneous layer of the skin is hypodermis. The surface area of the skin is 1.5 to 2 meter square, not a millimeter, it is a meter square. Next is a degrees amount of the oxygen result in the skin is called cyanosis. Then contraction of arrector pillae muscle is called the goose booming. Goose booming is nothing but the hair will be standing in erect. Stratum lucidium seen in the palm and sole. The skin stores the fat and the water. The other name of a decubitic ulcer is called the bedsore. The outer layer of the epidermis is called stratum corneum. The deepest layer of the epidermis is called stratum basilae. The largest amount of the melanin gives the dash. It gives the dark color of the skin. The crimson color of the skin is due to rich of dash. So rich of oxygen rich hemoglobin. So it's giving the crimson color. Sebaceous gland not present in palm and sole. There are about dash million of sweat glands present in. There are about dash million sweat glands present in the dermis of skin, 3 to 4 million. Okay, dash sweat gland present in the axilla and the groin area. Apocrine sweat glands. So apocrine gland sweat is called the dash sweat. It is a cold sweat. In skin, dash does not have a blood supply. So the superficial layer of the skin does not have a blood supply. So it is epidermis. The insect of Sarcoptes bites cause. The insect of the Sarcoptes bite cause psoriasis. Yes. Next is a ringworm infection in the scalp is called tinea capitis. Ringworm infection between the toes, it's called tinea pedis. It is otherwise called athletic foot. The viral infection of the skin is herpes simplex, herpes zoster. Okay. The sebaceous the subcutaneous or the superficial fascia below the skin is. So what is the answer? It is called hypodermis. Understand? Yes. The collagen fibers gives dash to the skin. Collagen fibers giving a strength to the skin. The inflammation of the sebaceous gland gives rise to dash at puberty. It is causing the acne. Okay, next we will see one of the important question always been asked, that is about the functions of the skin. So you remember in this way, functions is always protection function. Protection function means it's protecting from bacteria and then mechanical injuries and about the physical agents, UV rays. You understand? So the bacterial infection, mainly dermis, they have a longer hand cells and they are protecting against bacteria entering into the skins. and regulation of the body temperature. So it's producing the sweat and prevent the heat loss, conduction, convection, radiation, evaporation. So it prevent the heat loss. And temperature receptors of the skin, the hypothalamus. Really the temperature regulating center in the skin is called hypothalamus. According to that, skin will be producing it and maintaining the temperature. So perception of sensation. So perception of sensation. What is perception of sensation is another important functions. So it is sending the impulses to the brain. Okay, either the pain impulses going to the sensory area of the brain, and it is coming back as a motor area, so that you are immediately withdrawing. So that is the sensory impulses are sending, playing a main peripheral nervous system. And the storage, the skin, already in the question we have seen, the skin is really storing the fat and the water. And the skin is another important function, synthesis of vitamin D, cholesterol of the skin to vitamin D. So skin playing an important role for synthesis of vitamin D. And another important one role is called excretion, right? Kidney, how it is excreting larger amount, though the skin is also excreting urea, salt, fatty substances are excreted through the along with the sweat. So sometimes after the sweat you can feel some salt like a deposition throughout the skin. You can see when you are perfused, sweating is present. Then absorption. Sometimes the skin is the main function is absorption. We are putting some pain, ointment, everything has been absorbed through the skin. And also secretory function. So it has got apocrine, ectocrine, the sweat glands are present. So they are always like bringing out the waste material through this one, secreting. So smooth. Also it helps to keep our skin smooth and moisture. Are you understanding? So it helps to regulate the temperature. Okay, the sebaceous gland mainly in the skin, which is producing the sebum. Okay, this sebum only help to smoothening the and moisture and keeping the cells very moisture. So the dryness will be avoided in the skin. So this is the one important question I added along with the 1 mark question. So one is mainly layers of the skin you study, at least the layers of epidermis, okay, and layers of epidermis, if not the layers of dermis, at least you study that, and the functions and the glands what is present, and the functions is very very important. So you remember like 9, like protective function, regulatory function, temperature receptor in the skin's temperature regulation function also you can tell, and the perception function, right? You can perceive any impulses can be perceived, storage function, synthesis function, excretion function, absorption function, and secretory function. So these are all the functions of skin. So hope it is a good revision for you. So this printout I am sending you in the WhatsApp. You maximum you find out the answer. You after finding out the answer, you watch for my video for the right answer. Okay, thank you.